Welcome, ladies and gentlemen, to another exciting episode of the Clean Talk. Infection preventionists in healthcare are often flooded with product pitches. Each vendor claims that their product or solution is the best, but which one really is the best? Today, we will ask an infection preventionist what he or she expects from their hygiene vendors. We are going to ask this question today to our special guest, Mr. Sravan Kumar, Head of Quality and Patient Safety at Mediclinic City Hospital. Welcome to this episode of the Clean Talk, Sravan.
Samya, thank you very much for invite. I'm happy to be associated with Clean Middle East and happy to share my thoughts.
We are happy to host you. Sravan, my first question to you would be, what are the key factors that you consider when selecting a hygiene vendor?
The first thing that we always look at is the product efficacy and quality. Of course, there are multiple factors, but the product quality and efficacy trumps everything else. We look at the broad spectrum the product works on, whether the bacteria, virus, and fungi. And also, we look at the time it takes. The contact time is one of the important aspects when it comes to cleaning and disinfection. So we look at the products which act at the least acting time. Apart from that, of course, the vendors' credibility and reputation in the market. If they are somebody who's already been in the region, we try to find out from other organizations who are working with them about them, and also do a lot of research on the website generally. Then we look at the cost and value. Because of course there's always a limitation in terms of the amount of money that we can spend.
Definitely.
Especially considering that there are a lot of options that you have in the region. And then we look at their supply chain credibility in terms of making sure that we get the products in time whenever we need, the shorter turnaround times or lead times for getting the products, and just be available when we need kind of their expertise or any issues. Especially nowadays, it's just not the products that we're using. We also use the technology.
Yeah.
So their ongoing and continuous support is paramount for us when it comes to selection of the vendors and the products.
Definitely, and very well taken all your points. My next question, as you mentioned, innovation is very important, and I want to discuss this in detail. So how important is innovation in hygiene products and technologies, and what advancements do you want to see coming from vendors?
It's one of the most important aspects. Again, like I said, gone are the days when healthcare providers, or for example housekeepers, had time to kind of mix the chemicals or disinfectants products and then use them. So nowadays, we always try to work with vendors who have some kind of technology which helps in process efficiencies for us, and also accuracy in terms of the compositions that we use the products in. For example, the automatic smart vending machines, that mixers that companies use these days, and smart sensors for monitoring whether it is hand hygiene compliance or UVC disinfection, or monitoring compliance of the healthcare providers in terms of bacteria on their on surfaces or on their hands. So it is extremely important. What we look forward to is of course, there are multiple solutions available in the market these days, but integration of these solutions with the softwares that we already have, the facility softwares that we use to be able to track, for example, real-time consumption, real-time audits data, real-time compliance data of hand hygiene, for example. This kind of integration will help us to have seamless availability of the data and real time also to make sure that we action them rather than depending on either healthcare providers or the vendors to give that information to us.
Definitely. You also mentioned, Sravan, that their ongoing support means a lot to you. So a lot of hygiene vendors, what they do is that they provide training to their end users.
Yeah.
So how important is this training, and what role does it play in compliance?
It's again a very important aspect when it comes to training. Although we work with healthcare providers who have kind of a lot of experience in the field. working in particularly, for example, central sterile supply departments or in the operation theater, key areas of the hospital, or in housekeeping per se. But that being said, each product is different. Like I was talking about, a simple thing like composition of the chemicals, when you use them, are you using the right compositions? And there are different products which work on different equipment or different surfaces. And also the contact time is again very important. So while the healthcare providers have the experience and they kind of have the know-how, it's always important to get the first-hand information from the vendors to ensure that we know the products better and work with them instead of relying on websites or Google for information. So it plays an important role. In fact, the vendors that we work with, when we first get associated with them, we get training. And there are continuous trainings which kind of have win-win situations for both us as well as the vendors.
The vendor, definitely. Yeah. My next question, Sravan, is, as you mentioned earlier, efficacy trumps everything. So how do you assess the effectiveness and efficacy of a hygiene product or solution?
So multiple ways. When we buy a new product, the only source that we have is their reports, their research reports, the trials that they have run, or some kind of agencies referenced by some agencies like WHO or CDC and so on and so forth. So that's the first thing we look at. Two, if, like I said, if they're already associated with some hospitals here, we kind of get a word of mouth, informal feedback from them, how is it working and so on and so forth. And once so that happens before we get the product or in place. Once we have the product, then we compare before and after implementing. What was our rates before, what were our rates after. While that being said, you may not be able to attribute the infection rates solely to a particular product or disinfectant. That being said, you kind of get an impression as to what was it. If it's like a 5-10% here and there, you kind of think it's okay, you assume it's okay. But if there is a big variation, then you want to study further, deep dive the data to see what are the reasons which kind of led to the infections. And the fourth that we always look for is staff feedback. And again, especially in the initial days of the product consumption or product use, staff feedback gives a lot of confidence in terms of how, because these are the ones who have used it, multiple products. They kind of have an understanding of how the product is. So again, that helps. So these are the four things that we do when we want to evaluate the products.
Wonderful. And my last question, but definitely not the least, what level of transparency and data reporting do you expect from your vendors?
Especially these days, information is everything, right? Every decision that we take depends on the information.
Definitely.
So again, like I said, if they are somebody who is new to the market or new to this region, we would expect them to share their trial research reports or testimonials from the other hospitals that they've worked with. And the product details itself, how safe it is for the healthcare providers to use, how effective is the product on so and so. Not just what they think is right. Again, like I said, a research which is kind of authenticated or authorized by an agency like WHO, CDC, or FDA. The other thing we look at when it comes to data sharing is especially when we use their products and they kind of have this information. For example, consumptions. When we talk about, a lot of the times now when we work with vendors, we are not the ones who kind of refill those canisters. They have their own dispensing systems. They kind of refill it and they manage it on their own. So when we do that, again, an accurate data of and real-time data, which helps us in taking decisions. The last thing again is if we integrate our systems with them, we would like them to share every possible detail, not just the goods, not just information which kind of makes them look good or show good or good results, we would like them to have all this information kind of shared between both parties so that both of us can work on it. And also, while we get this information from external sources like health authorities or CDC, FDA, if at all there are any product complaints or issues around about product recalls and so on and so forth. While we get that information, we would have to actually look for it. Sometimes we miss it. So if this information comes from the vendor themselves, it would be really good. I mean, that would establish their credibility and also give us confidence to continuously work with them.
Definitely. With that, we conclude this episode of the Clean Talk. Thank you so much for joining us, Sravan.
It's such a pleasure to be associated with Clean Middle East, and thank you, Samya, for the invitation.
Thank you so much. To all our viewers, if you like this episode, don't forget to subscribe to our channel and spread the word. Until next time.